In healthcare, the only constant is change. We are swept along by powerful currents, technological revolutions, shifting regulations, rising costs, and the ever-evolving needs of our patients. In this environment, to stand still is to fall behind. Our choice is not if we will change, but how. Today, we will chart a course through these waters. We will explore the strategic compass that gives us direction, the human engine that drives adaptation, and the economic realities that demand smarter, more sustainable models of care. Part 1. The Strategic Compass. Planning for tomorrow, today. Without a destination, any wind is the wrong wind. Strategic planning is our process for setting that destination. It is our collective answer to the question, where are we going and how will we get there? This is not a solitary exercise. It begins with deep consultation, engaging staff, patients, and partners to ensure our direction is inclusive and grounded in reality. We then turn inward and outward, conducting a clear-eyed SWOT analysis to honestly assess our strengths, weaknesses, opportunities, and threats. But a plan is just a document if it isn't brought to life. Implementation is where vision meets action, where we allocate resources, sequence activities, and mobilize our teams. And crucially, we must have the courage to evaluate our progress with impartial reviews, learning from our missteps, and celebrating our advances. The leader's role in this process is to be the chief navigator. This requires an inspiring vision to rally the team, unflinching communication to maintain trust, and a deep commitment to empowerment, ensuring every team member feels ownership of the journey. Part 2. The Human Engine. Leading people through change. Yet even the most brilliant strategy will fail if our people are left behind. Change is not just a logistical challenge, it is a human experience. This is where organizational development comes in. The deliberate effort to strengthen our organization's health by focusing on our systems, our structures, and most importantly, our culture. We must understand that change is disruptive. People naturally respond with a spectrum of emotions, from seeking information, to denial, to passive opposition, and eventually, we hope, to acceptance. Our job as leaders is not to dismiss these reactions, but to anticipate and manage them with empathy. Successful change management rests on 5 key pillars. 1. Creating understanding. Why is this change necessary? 2. Communicating constantly. No one should be left in the dark. 3. Recognizing potential. Seeing the best in our people and helping them see it in themselves. 4. Leading by example, embodying the change we wish to see. 5. Empowering ourselves and others, building the resilience to see it through. Part 3. The new reality, the imperative of managed care. Now, let's address the powerful current that underpins everything, the economics of healthcare. Costs are rising unsustainably, driven by an aging population, expensive technology, and a historical focus on curative, rather than preventive care. The model of simply doing more, for more people, at any cost, is breaking. This is the hard truth that brings us to managed care. Managed care is not a dirty word. It is the necessary application of prudent business principles to ensure healthcare remains accessible and affordable for future generations. It represents a fundamental shift from a reactive, fee-for-service model to a proactive, value-based one. Its methods include restricted networks to control costs and ensure quality, negotiated tariffs and drug discounts, and a vital focus on prevention and personal responsibility. The benefits are clear: greater affordability and improved accessibility. But we must be clear-eyed about the pitfalls. There is a risk of rushed consultations, of necessary treatments being denied, and of physicians feeling handcuffed by financial constraints. This is where intelligent case management becomes our ethical guide within the managed care system. It ensures that cost containment never comes at the expense of quality. It's about coordinating care to avoid duplication, streamlining processes to save time, and exploring alternative, compassionate options like home-based care. Conclusion. So, how do we navigate this complex future? We must be strategists, charting a clear and inclusive course. We must be architects of change, building a resilient and adaptive culture. And we must be stewards of sustainability, balancing compassionate care with financial responsibility. Let us embrace this challenge not as a burden, but as our generation's calling. Let us build healthcare systems that are not only clinically excellent, but also strategically sound, humanly centered, and financially sustainable for the long haul. The currents of change are upon us. Let us be the leaders who dare to steer. I hope you enjoyed the video. Would appreciate it if you'd like the video and subscribe to the channel so we can reach more listeners like yourself. Until next time, stay informed, stay healthy, and continue exploring the world of healthcare with us. I remain your host, Sunday Clement. Thanks for listening.